breakout session of our 2025 Serving Those Who Serve Conference. My name is Steve Gill. I'm the Interim Assistant Director with the Washington Department of Veterans Affairs, but I've been with the agency for over 20 years in different roles as a Veteran Service Officer, working in outreach, our estate management program, the tribal liaison. I've worn lots of hats over the years, and when I'm not the Interim Assistant Director, I'm normally the administrator for our Veteran Services Division. So our Veteran Services Division manages many of the field service programs that we have around the state, the biggest of which includes the work we do with veteran service officers, our partners with counties, with Indian tribes, with nonprofit organizations that do VSO or veteran service officer work. But it also includes our transitional housing program, our fiduciary services, services for transitioning service members becoming veterans, our LGBTQ outreach, our small business registry. I need to pull out a notebook because there's a bunch of little stuff in there. But I'm excited today to be the moderator for this session. I'm going to just go over a few of the reminders here. These are the same reminders that you're going to hear in every breakout session, so just bear with us there. And then turn it over to our guest. So we have 90 minutes, but we don't necessarily need to use all 90 minutes. If you finish early, go out and enjoy the vendor booths. There's lots of good vendors out there, lots of good partners, resource tables, not really vendors, they're resource tables. And they're there for you to enjoy and network and make some connections. No special announcements other than we hope to see you all at the social networking event at Single Hill Brewery later on this evening. There is a QR code on the back of your name tags, as you learned earlier. One of those codes will take you to the program, so you can get the agenda and the background information. You can also get copies of the presentation. The other one will take you to a feedback survey page, so you can give us some feedback on the individual breakout sessions, and then eventually you'll get a feedback ability to provide feedback on the entire conference. Let's see here. We will do Q&A. Our presenters today are pretty experienced in their work, so we'll allow them to take questions as they go through and tackle those questions. Obviously, if there's anything that is sensitive, if you want to talk about your claim or something that is unique, let's take that offline, right? It's okay to have discussions about, anecdotally what we see, but we don't want to have discussions about individual people's claims and that type of work, because that's sensitive and we want to be respectful to those veterans. We are going to ask our presenters, and for that matter, any audience members, to use the mic so that we can pick it up on camera. These sessions are being recorded, so we'll have a mic for questions as well, and I'll make sure that mic's available when we do the Q&A. With that said, I hope you all enjoy Serving Those Who Serve in this session in particular, and I'd like to turn it over to Steve Strope at the Seattle VA Regional Office.
Thanks, Steve. All right, my name is Steve Strope. Okay, I am here with my public contact coach, supervisor. Her name is Lonnie. To make things easier, you could also call her Steve. So I am the Veterans Service Center manager of the Seattle VA Regional Office. So I handle compensation benefits as well as outreach for all of the veterans in Washington State, right? So if I go up, anytime I drive up to Bellingham on I-90, or I-5, I drive out here to Spokane, I-90, anytime I cross, I see a veteran driving with a Navy or Vietnam veteran hat or anything like that, I think, yeah, that's one of mine. So I'm very proud to be doing what I do. I've been working with the federal VA for 23 years, right? And I know a lot of you are prior military, so you're familiar with the concept of death by PowerPoint. I intend to bring you to the cusp of that, but I got some dry stuff. I'm trying to get through it as quickly as possible to open it up to Q&A. And it's my intention that I will not leave that door until all questions are at least addressed. Or I'll leave that door. Right, and again, before we, before we get to any kind of thing, I just want you all to know that I'm here for you. You're the reason I have a job. You're the reason why I continue to stay at my job, right? And this mustache is not the mustache of a man who is averse to be getting criticism, right? Let's just say that, right? So again, I'm here to hear from you. I'm here to answer your questions. I'm trying to get through a few slides. I guess that's just mandatory at these types of events, but again, we're here for your questions and for your feedback about federal VA. So our office is in the Jackson Federal Building, 915 2nd Avenue. It's 2nd and Madison downtown. It's really convenient. You can get off at the Symphony stop on the train or the Pioneer Square, and it's also right across from where the ferries come in. We have a small, lean but mean public contact team there. We're happy to have anybody come in. There's also ways to schedule, whether online, telephone, or in-person meetings. So that's where we head up shop there. We also have a kind of smaller presence out in Spokane, downtown Spokane at the Thomas S. Foley Courthouse. We have a few claims processors there, as well as a public contact team. We're still really excited about our Spokane office because as long as we've had the Seattle regional office, it's, I don't know how many decades, this office in Spokane, we've only been there for maybe 5 years, probably less. And all the veterans on the eastern side of the state, it was really, really hard for us to get out there. So we are really happy that we're being able to get to see folks, do some outreach, as well as being open to folks that might seek employment here with VA, but may not want to live in Seattle. Okay, so what I do in the Veterans Benefits Administration, okay, I'm not here to cure, treat, or prevent any illnesses, right? But what I do handle is the disability claims. I can help help you to submit a claim for pension. While my office doesn't handle that, we send that off to the pension management centers. There's 3 of them across the country, one of which is my old station, Philadelphia. So I have some pension knowledge as well. Pension is a little bit different because it doesn't deal with service-connected disabilities, but it deals with people who are disabled for other reasons, non-service connected. But there is an income limit. So that's very, very important to keep in mind. As well as survivors benefits. While again, my office doesn't handle things like DIC. I know there was a question in the big group about DIC benefits. We can help survivors really who don't really know what to do sometimes, and you can for the veterans. we can tend to handle things ourselves, and we know how the VA works, but not always our spouse knows. And when we pass away, maybe our spouses don't know what benefits are eligible and available for. So again, we try to have the no wrong door philosophy, which is if you come to see us, we might not know all the answers. In fact, we're probably guaranteed to not know all the answers. But in my 23 years of the VA, I've made a lot of contacts, and I can try to find somebody who knows. And again, I don't want to send anybody packing without, or send anybody going home without some idea of who might help them or how they can continue to get their ball moving forward. Also, Veterans Benefits Administration, we handle things like education, GI Bill, vocational rehabilitation, online guarantee, life insurance, burial benefits, etc. Right? I think it's 2025, so really, if you can imagine a veteran benefit, there's probably somewhere out there that it might be available to you, whether it's state, local, federal, or just all the other wonderful things that people in our vendors area are offering, right? So again, this it is a resource, and as the federal VA, we try to coordinate as much as we can and help people to get an answer to their questions. And this is just a kind of brief overview too, because I don't know what everybody's knowledge of what we do is, but Service Connection, and I'm not going to read the PowerPoint for you, but there are several different ways that we can grant service connection for a disability. I'm going to go into the PACT Act later on, because that widen the possible ways that we can grant service connection. But for disabilities, there are several different avenues of how we can grant service connection. Right? There are some disabilities that happen in service, right? So, and you can point to a specific event that happened in service. You might have been deployed, you might not have, and there's a specific event, and you went to the doctor or whatever, you went to the hospital for it while you were in service. But that might be the clearest one for somebody who is outside of VA to understand. But there are also other types of disabilities that we may presume to have occurred in service, right? So there's, I think the one that at the top of my head, and definitely the one most alphabetical, is ALS. So if you served in the military and you ever develop ALS, whether you're a World War I veteran or you're just coming out of the Space Force, right? If you develop ALS, you don't have to point to a specific point in time where you went to sick call or whatever for ALS. Right? We presume it to have happened. Right? So there are often a lot of disabilities that people may not know that they might be eligible for, but VA knows that, hey, there's ways that we can grant service connection for those things. So, not yet. Disability rating. Does anybody want me to spend the next 87 minutes discussing VA math?
VA can do math.
I'm looking for a yes. Okay. But the disability rating for somebody from from the outset, we can grant for specific disabilities 0%, 10%, 20%, 30%, up to 100%. And then when you get 100%, there's extra special monthly compensations that we can grant. Now, unfortunately, I'm reading the room here, and you don't want me to explain how the VA math, how we calculate multiple disabilities, right? But suffice it to say that if you're 50% for one disability and you're 50% for another, we don't add those two to give you 100%, okay? That's actually 80%, okay? But I assure you that it's not just me and a bunch of mad scientists having a dartboard and throwing it and saying, okay, all these disabilities total up to 60%, right? There is a specific formula that we have to use that's set by Congress for us. And really quick, like I said, the avenues of service connection, direct, which is the one that would make most sense to people who don't know much about the VA process. There's presumptive. Aggravation is if you had a disability that is made worse by your service-connected disability. And secondary, where one service-connected disability causes another disability. I don't expect anybody to memorize all of these, but the reason why they're on the slide is if somebody reaches out to you and they don't think VA could grant something because it's not direct, understand that there's other avenues that we could be looking for to grant. Okay, PACT Act. The Sergeant First Class Heath Robinson, honoring our promise to address Comprehensive Toxics Act. Okay, that was signed into law 2022. Pritz and Emmett spoke to it when they were in the big room. I'm speaking to it now as well. Giving a lot of airtime to it just because it was huge. It was the biggest expansion in VA benefits pretty much ever, right? That definitely since World War II for sure. Okay, what PACT Act did is, so it expanded the number of disabilities that we can consider presumptive. It expanded the veterans who were eligible for compensation for VA benefits. Also, and this is something that maybe somebody from the outside can't see, is that it made it much harder for VA to give a no or to deny a claim. Because I'm seeing my people when they're working these claims is that they have to do extra steps of documentation. They have to do a little bit more research. Say, okay, based on your MOS and where you were deployed and things like that, were they exposed to these things that maybe aren't apparent on just what they wrote on their claims forms, right? So we're going a little bit more in depth to try to figure out not just the surface level details of each individual veteran's claim, but looking into kind of more deep into what your actual individual service was like. Right? So, yeah, whatever MOS you had, let's say you might be in the Army at 68 whiskey or something like that. Just because you had the same MOS as the person sitting next to you didn't mean that your service was the same, exact same, right? So yeah, that's a huge thing for us on the claims processing side. All right, so these are just a list of some disabilities that were expanded during PACT Act. And there's also expanded lists of regions that we can consider veterans as presumptively exposed to toxic chemicals that might lead to a disability. That's again, like I said, you may not have any of these. You may never get any of these. However, we've gotten 2.9 million PACT Act claims already. We've granted 2.6 million already. So these veterans are out there, right? And one of the things that I'm proud of us in VBA, what we do is we grant disability compensation, which may give you some money every month, but it opens the door to so many other things, like healthcare, right? It opens the door to all those other benefits, vocational rehabilitation, education loan guarantee, and all those other kind of things too, right? So again, I may have said it before, but I don't say it enough. File the claim, right? But probably the best time to do it was yesterday. The second best time is now, right? Because you don't know what you might be eligible for, and some people might feel they don't need the money. I am never of that opinion, but it also getting granted service connection opens the door for so many other things. And again, this is we have all these different numbers, and they change almost they change every day, but that's just because this is what we are working on right now. PACT Act claims are coming in every second. This is what we're working on. So again, it makes it much harder for us to say no, which also means that we're saying yes a lot more often. And I see a lot of these awards when they come through, and did we say the retroactive benefits that we paid? Okay, 11.64 billion, right? I did the quick math based on what Emmett and Pritz talked about in the big room. But PACT Act claims granted, that seems to me like it's been an average of 4,000 in retroactive benefits per granted claim, and that's nothing to sneeze at, right? That's pretty good. Okay, this is what we consider toxic exposure. And if you want to kind of look through that, so say not many of us veterans were exposed to nuclear weapons testing, but pretty much everything else pretty much all of us have been exposed to one or many others of those toxic exposures, right? So again, this is just here to illustrate all those things that we are looking into when we get a claim under the PACT Act, and all those different avenues that we have to delve into when we're making that determination. There's some things that pop out to me: vibration, noise, special paint on military vehicles. Again, you may be eligible. You know, it's likely, and the person who asked you for help may be eligible too. So again, file the claim. And then this is just the different ways to file a claim. I think va.gov is a great resource. For those of you, there's a VA app. I have that downloaded. I think it's pretty cool. You can get a lot of information there, and also help you to file claims. I think it's even possible if you need a quick benefits letter for whatever reason you need it, whether you're applying for a home loan or something like that. It's able to get that information to you real quick. But that is the one that is the website and the app are really great resources on how you can file a claim. Obviously, too, in person. Come to the Jackson Federal Building in downtown Seattle. You can see Lonnie and her team right on the first floor. Also, we have in the Federal Building, going up a few floors, on the 10th floor, we have all our veteran service officers. So the DAV, the VFW, the American Legion, all those folks, they're there to help you as well. They are a great resource to kind of advocate on your behalf, because and I'm on the claims processing side. I have to follow all the rules and things like that. I have to actually look into and generate the rating, but the American Legion can help you from the other side of the fence. The American Legion, DAV, VFW, WDVA, so forth. They can help you on the other side of the fence to say, okay, this is what you really should file for. This is the documents you need. How can you help get them? They're wonderful. I work with them all the time. And yeah, next slide. Oh, did I miss one? The Vera. Yep, Vera. Oh, back.
I don't think it's there.
Yep, right, that one. So right now, Vera is the way that someone can schedule a meeting with a VA representative, and that's either in person, if you want a telephone call, if you want kind of a Zoom meeting or whatever. You can schedule one through Vera. And one of the wonderful things about Vera as well is that there's one Vera for all VA, and if you put in your zip code, it will figure out what the closest VA office is that might be able to help you. Right? So if you're thinking, somebody maybe living in King County, and say, okay, you go on Vera and you can schedule an appointment with the Seattle VA. But if they live further out, like, well, I don't know. Yep, same thing, Vera. And if the Spokane office is closer, it will send them back to the Spokane office. If you're out of Washington State, same thing, Vera. If you're on vacation in Florida or something and you talk to a veteran, tell them to go to Vera and schedule an appointment, and wherever they live, it will bring them to the closest office. Now, how do you get there too? I think the easiest way is to just Google Seattle VA Regional Office, and our website will have a link to Vera, and you click on that and get in touch with somebody. And these are some things that we can help you with in our public contact office or wherever. Personal health inventory, my healthy vet account, VA mobile app, like I said, all those other things. And we don't know, we don't have all the answers, but we are here to help. That's why we're there. That's why we're here. And we're here to talk with you and whoever comes through our door to see if we can do something to help them and get the benefits they have earned. Read it? Yeah. All right. So, okay, we made it. All right. So, we got some questions. I'm here. Lonnie's here. I think, Steve, we have some questions over here.
I'm gonna help facilitate with the mic. But before we get to the questions, I just want to talk briefly about how important these benefits are for not just veterans and their families on the individual level, but for the economic security of those veterans, but for the economy in Washington State. Let's put this into perspective for a minute. So we know that about 31, maybe 32% of the veterans in the nation and our state are receiving a VA service-connected disability or non-service-connected pension. There's only about maybe 3,000 veterans in Washington State receiving pension. On average, if we average that, it's about $1,900 a month in VA disability income that veteran, that family is receiving tax-free. You do the math on that, that's about 3.2 billion with a B, billion dollars a year in VA disability benefits getting paid directly to veterans and their families in Washington State. That's huge. So it's not just the economic security of that family, that veteran, that's always the most important thing, but the economic opportunity that creates for the community, because veterans are going to spend that money. They're going to spend it on rent, food, utilities, transportation, buying groceries. They're going to spend it on living. So when I'm talking to legislators and policymakers at the state level, I'm frequently talking about that return on investment that happens when we help veterans apply for veterans disability benefits. Not to mention all those second to third order benefits that Steve mentioned, access to VA healthcare, BR&E, survivors benefits, education benefits, employment benefits. When you start adding all of those, we get into more billions of dollars a year in our state, as well as the improvements in health and in the lifespan of veterans receiving VA healthcare and access to those healthcare benefits. So this is huge, and I think we all know this as individual veteran advocates, service providers, some of the folks in the room are veteran service officers, and we hear this every day. And since that PACT Act passed 3 years ago, August of 2022, the number of claims, VA disability claims that our veteran service officer network here in Washington State has been working has doubled. In 2022, we were about 8,000 claims a year in our network of state, county, tribal, and nonprofit veteran service officers. We broke 17,000 last year, state fiscal year, so just wrapping up in the end of June. So the PACT Act had a huge increase in eligibility for veterans, and that's going to continue for decades as we all age, right? And unfortunately, we're not getting any younger. So veterans like myself, I don't have those conditions today, but that might be different in 10 years from now. So the work that we do, collectively is helping veterans. Where do I go to get started? How do I access these benefits? How do I connect with a good veteran service officer? That's going to help me for free of charge. How do I log into my VA.gov account? How do I enroll in VA healthcare? How do I do all these other things? And We're going to talk a little bit more about that in the panel discussion that we have tomorrow afternoon in the same room about collaborating with veteran service officers, because there's a lot of important collaboration between community organizations, nonprofits, counties, Indian tribes, and veteran service officers from different types of organizations. So that's like a whole nother topic. Today we wanted to get an update from VBA's perspective, from the Seattle Regional Office's perspective, because it kind of grounds us in why this work is important. Big picture and a macro level in terms of access to programs and services, and we all know why it's important at that individual level. We've all worked with those veterans and those families and seen how life-changing these benefits can be. So I just wanted to put that in perspective because this is incredibly valuable information, and in the PACT Act, again, it can't be overstated how much it's improved or expanded access to VA disability benefits, eligibility for VA disability benefits. I went back to 2009, and it was only about, I think it was 11 or 12% of veterans in our state were receiving VA disability benefits. And as I said earlier, 31, 32% now. We have some counties in our state where it's over 40% of veterans. I have that data down to the county level. So we know we have a lot of work to do. We know there's more veterans out there that are eligible, that probably should be receiving these benefits that aren't receiving them yet. It would be wonderful if we didn't need these benefits, right? If no one ever got hurt, if no one ever got sick, if no one ever got injured, that would be great. I'd love to go climb mountains, but I was a clumsy paratrooper, so I'm service connected for that knee. I am not climbing mountains, right? So that those disabilities have an impact on my life, whether I like it or not. So, and when that happens, veterans deserve these benefits. So we'll go ahead and we'll turn it over to questions, just putting a little perspective behind the discussion. And again, we'll use the mic for questions so that the video picks it up, and we'll just work our way across.
So my name is Chris Diaz, Skagit County Veteran Service Officer, and partners with the WDVA. And I'm happy to say that the impact that we've had in Skagit County, my position and the other county commissioners they've already approved hiring another VSO coming soon. But my question, Steve, I love the mustache. First, let me put that way. I love, see other people's facial hair, and I think it's pretty cool. Something that's been discussed year after year as serving those who serve is the expansion of the PACT Act even more because of how many claims I'm receiving under Agent Orange of different other organs in the body. The changes for hearing and tinnitus, there's a lot of these rumors flying around. I got veterans coming into my office. I'm wondering if you could give us some answers on those so I could give them some answers.
Hey, Chris, thank you for the question. Trying to think how I can answer this. I want to answer from the global perspective, and for me, working in VA for 23 years, I've seen a lot of changes, right? And VA is always behind the times, right? You talk about Agent Orange, but Agent Orange wasn't always a thing. Right? It was a little bit before my time, but it was because of a lot of veterans who were submitting claims for this and pushing for political action and so forth and so on. We have to deal with the regulations that Congress gives us, right? And it's not always up to the secretary to determine things that can be compensable. But I've seen so many things that it's just, again, we're talking about expansion because that's what we continue to do. We continue to expand. We continue to see veteran groups that were overlooked, and then through the force of veterans just fighting for the benefits that they earned and filing claims, that we have been able to grant more benefits and opening up the kind of range of things that we can grant, right? So, you know, the disabilities of today and the ways that we can, the ways that we process claims today aren't necessarily the ones that are going to be with us tomorrow, because we're constantly learning, we're constantly trying to evaluate disabilities and looking at demographic data and all this other kind of data to see, hey, what kind of disabilities are affecting veterans and which kinds of veterans. You know, there was a few slides back where it listed all the specific disabilities. And again, those specific disabilities didn't come from that dartboard that we used to figure out the VA math, right? It was because of demographic data, health data that we were putting together and other things to say, you know what, we have figured out a link between this disability and the veteran populace or a certain veteran populace, right? So those are the kind of things. We're a learning organization. We are not a really great predictive organization, but again, that's from my experience, I see that the VA continuing to evolve and continue to be, I guess, cognizant or just reflective of what veterans are facing. But again, we really, it's really hard for us to get out in front of those kind of type of things. I hope that answers. Yeah.
All right, we're gonna work our way around the room.
I don't know.
I have two questions. One of them is hopefully short. Fritz mentioned the accuracy rate. How is that determined?
That is determined, so it's issue based. So so the Seattle Regional Office, thank you for giving me this opportunity to brag about this at Seattle Regional Office. So we're I think top 5 in the nation in quality, and we're just a little bit above 96%, right? So that it means that for every 50 disabilities, we are correct 48 of the time, right? So now, one veteran might submit a claim claiming only maybe left elbow condition. That is one issue. Other veterans who might have just gotten discharged from the military, they might put a claim with 20, 50, 75, right? So we have a national reviewing team, and they review these claims, and they total the number of issues, total the number that are granted or that are decided, and they evaluate each individual issue to see if that is correct. Now, for correct, I mean, is the evaluation correct? That means, did we grant 10% when it should be 30%, et cetera? Is the grant correct? Did we say yes to service connection when the answer should be no, or try to get more information? And those are the kind of main things.
Then my second question is, we, from the Attorney General's Office of Voluntary and Veteran Assistance, and we visited the Stafford Creek Correctional Center last year down in Aberdeen to visit their veterans lot. And one thing that the veterans mentioned over and over and over again is how much difficulty they've had accessing VA benefits and VA exams. Is there anything that the regional office is doing to improve access to benefits for incarcerated veterans, recognizing that even that they're not eligible to get most of those benefits even when they're incarcerated?
Yeah, that's something I'd actually been working with for years. Going to the main kind of the main intake facility for the corrections, for the male inmates and also the female inmates in Purdy. as well. I mean, we were focusing on one, when a veteran is incarcerated, their disability compensation, it doesn't stop, but it gets reduced to either a smaller amount, either 10%, or if they're only getting 10%, to half of 10%. And it's really incumbent on us to try to make that change happen sooner rather than later, so that they don't, when they do get out, they're not faced with some massive debt that they owe VA. As well as when they get out, that we want to restart their benefits as soon as they are discharged, because it's hard enough getting out of incarceration, but if you're getting out with absolutely no income coming in, that makes it harder for them to get back into society, right? So that is something that has been a collaborative effort that I've been involved in for maybe eight or nine years. I know the Washington Department of Corrections, they probably had a lot of turnover, and so maybe something that we can get back out there as well to do. Now the part of examinations for incarcerated veterans, that is a sticky wicket. That is a little something that is difficult. One thing, we do have processes in place on how we can conduct examination for incarcerated veterans. Brits made a reference to our medical disability examination office in central office, so there are ways that we can coordinate, but again, that is one of the more difficult things that my office has to do, is because there's all kind of things that we have to ensure, not least of which is the doctor's safety when they're going behind the wire.
So I'm going to say thanks so far. So you're doing great. You've been doing great. You guys caught a lot of arrows earlier. I knew that was the case. But I have a couple of questions. I'm one of the veterans employment reps for Snohomish County, and we deal with a lot of veterans. And one of the questions I'm looking here trying to become a little bit more familiar with the PACT Act. But I also know that some people have been denied prior to the PACT Act, and what was previously denied is now, based on the PACT Act, is now considered presumptive, or at least that's what it's appearing to be. So how do I get somebody re-engaged? I'm looking here at the VERA, that sort of thing. So that was one option. I'd like to hear a little bit more how to get re-engaged in order to potentially file.
Yep. So the PACT Act was signed into law on August 10th of 2022, right? So we that created that's kind of the baseline, the starting date of disability. Things that happened before then, we didn't create a kind of look back period for those things. It may sound like a broken record, and may sound like it's an easy answer, but file the claim, right? We may be able to grant some retroactive benefits. We may not, but again, just filing the claim on va.gov. If you want to schedule an appointment with VERA, Google Seattle Regional Office, and that will get you in there. Talk to WDVA service rep, the AV, American Legion. All those folks can help. But again, I just want to press up upon you, the veterans you meet, because I understand that you're going to meet a whole lot more veterans than I'm going to meet in my daily life.
You're not answering the question.
So,
how did you do it? Do you start it as a new claim, or since it was denied, do you do it as an appeal? That's kind of what he wants to answer.
right, so that would depend on a lot of other different factors too, is like when it was decided, those kind of things. If it's been a long time, it would be a reopened claim. And again, the service officer might be able to look into your details more and help give you some advice on what exactly to claim.
Okay.
Yeah.
That's, at least it's a starting point. That's really what I'm trying to figure out there. The other, the second part is we have, as we know, we have a huge homeless veteran population throughout the state. Other side of the mountains, a lot. And I know the VSOs are able to help, but I'm kind of curious as how I can get some of these same individuals in contact with a VSR, if that's even possible.
Like one of my claims processors to,
Correct. I mean, somebody who can, because I know that the VSO is limited on what they can do and how quickly and so on and so forth versus a VSR.
yeah, well, the VSR can only start working with the veteran once the claim is filed. You know, we do homeless outreach. You know, we try to find homeless veterans as well. The thing with homeless veterans, there's also a lot of other things at play as well. So less than desirable discharges is probably the main thing that I can point to. So, but with that said, so many homeless veterans might have taken a look at their discharge and might not feel like they are entitled to any benefits. And that might have been true a few years ago. But right now we can take another look at the discharge and maybe see if we can write them in as well. Again, I'm gonna say, Google Seattle VA Regional Office, Vera set up an appointment, talk to a service officer. Again, I've got a small team, and while we do homeless outreach, you know, we might be walking down one side of the street, and there might be a homeless veteran 2 blocks over that we don't meet. You know, I'm here so I can kind of reach you. You can reach the veterans that you meet, and again, it starts at filing the claim, starts at reaching out to us, doing what we can do.
This is on, it is on, okay. So my name's Caitlin, I'm with Northwest Justice Project, and one of the things I wanted to ask about, and it's kind of in the weeds, but it's not super specific to any client set of facts. The claims accuracy review process, that's part of the higher level review. How is the Seattle Regional Office separating those out in terms of who's looking at them, and what is the timeline for getting decisions on those?
Yeah, the car pilot, okay, that's actually handled by our Decision Review Operations Center in the Seattle Regional Office. So it's not my division, but it's still in Seattle. I believe the time frame is 30 days, right? And I think I should know, and I apologize that I don't know what I think. I know the vast majority of those claims are processed within the time frame. I know there are, when a claim comes in, we put these specific kind of digital tags on these claims, and that's how we know that there's 2.9 million PACT Act claims, is because we put little PACT digital, so when the car claims come in, there are digital tags, and they get straight to somebody who can review them. And for everybody who's not aware of the car pilot, it's a way that, it's a specific type of claim that service officers are able to submit, where they say, hey, this is a clear and quick error that you made. Let's get it to the VA, let's get somebody to look at it real quick, correct your mistake, and let's move on, right? So I know our DROC organization likes to talk about how well the car pilot is working. You know, I'm a little jealous because I want those easy claims to come to me so we can get them done. So, but they're working them, and again, the car pod is still ongoing. It's still, they're still able to move those claims through real quick, and I think it's it's been really successful.
And I didn't get permission for a follow-up question, but something you said kind of triggered it in my brain. For those of us who have VBMS access, I know I'm going really deep in the weeds here, would we be able to see that it's been flagged with a car tag? 'Cause I can see when it's flagged with packed. Is there something that would allow, I guess I'm really just trying to figure out when something goes in, can we track that it's being processed through the way that you're identifying as opposed to it just ending up in the LR pile?
VSOs with VBMS access, can you see?
Have you ever looked for it?
You can see when it's being passed or when it's looked at, but you can't track it in the card systems. You can only see the documents being seen, and if it's being passed to different ROs or something to that effect.
There's a little section
Okay. Yeah, so it might, yeah. You might have gone beyond my car knowledge. Yeah.
I see hands starting to creep up. That's a good thing. We like to question, so just bear with me and I'll try to get to all the questions.
I was gonna answer his question to help him out.
Okay, well, let's use the mic so we can capture things on the video too.
So I'm in Skagit, but over in Snohomish County, we've got Stacy LaFlemme and her team there. They do indigent and low-income vets, but I recommend 211 to start off, to get those vets in there. And the VA has a website also that they can call for homeless veterans that will lead them back to those 211, BOA, all that stuff.
Okay, great. And I think there was a question in the back here, and then I'm going to come over to the other side of the room. I saw a few more. Thank you for being patient.
Hi, I'm Brenda Jones. I'm with WorkSource under ESD. The question I have for you is I've noticed each time I've seen the slides for the PACT, one of the things I've noticed is that there seems to be a huge gap in the timeline. And there is a very large group of veterans that don't necessarily fall under those specific wartime periods that you've got listed that have worked with radiation, burn pits, asbestos. Is there anything being done at this time to try and close that gap? If a veteran actually comes to a VSO or to anyone and says, I want to apply, are they automatically going to be told at that point in time, oh, I'm so sorry, but you don't fall in the parameter that is listed, here?
Yeah, there are specific disabilities and specific times and regions where we can grant presumptive disabilities for, right? So an old example is like Agent Orange, right? So when that first was granted, we said, okay, Agent Orange for people who are boots on the ground in the Republic of Vietnam. And then it took us a while to say, hey, wait a minute. Agent Orange didn't just appear out of nowhere in the Republic of Vietnam, right? It had to start somewhere, and it had to get transported through Thailand and places in Korea and all these other places. So we expanded coverage to all these other places. So for, let's say, a veteran who was exposed to a certain kind of chemical while during peacetime, say, they might not be showing up in those specific places at those specific times. However, they are still exposed to that toxic agent, right? And still under the PACT Act, we are there to kind of to run down every possible lead to say, okay, could service connection be granted this way or that way based on this service and this toxic event. Now, kind of still coming back to one of my earlier slides is that we need to have a current disability. We also have to have a nexus between that current disability and military service. Some of those disabilities, we have said that if you are diagnosed with this disability, it has to be within a certain time frame after service, right? So for ALS, it's at any time in your life. There are other specific disabilities, and our regulation is really, really long, okay? X disability has to manifest itself within 2 years or 3 years after the end of the disability. And in this room, I'm not here to adjudicate any kind of claims or to give anybody a yes or no. But again, my sincere advice is to say, hey, file the claim, right? And that, each individual veteran is different, right? Each individual veteran's service is different. And that there may be things in there that they didn't, maybe things in the service records that they don't even remember they had that might allow us to grant.
Thank you. I'm Jared Wood. I'm with the Washington State Veterans Employee Resource Group, the VERG. So I have 3 questions, one PACT Act, one on community care, and then one on providers. So with the PACT Act, one question I get a lot of, especially with the 20-year veterans that retired, they got their 100%, PMT, they got their medical, and they're like, well, should I still submit for the PACT Act, even if they didn't have the condition originally? And the concern there is really around DIC. If they don't meet that time limit, they get the DIC and they get one of these conditions, and unfortunately pass from it. What's the VA going to do?
You might have heard this one before, but I say file the claim. Yeah. It's again, it's a great point for you and those veterans you're talking to, but everybody in this room. Think about your family when you're gone. And again, I used to work in Philadelphia, so I used to work a lot of DIC claims, and it's I've seen a lot of death certificates. And one of an easy DIC claim is when a service-connected disability is listed as one of the cause of death, right? So it's easier for you when you're alive to get the claim in and go to your exam and submit more evidence. And possibly get it granted. It's made a lot harder once you pass away.
Right, and then as far as community care, we touched on it earlier. I would like to give props to the VA app, and especially I believe sometime in the past few years, you guys imposed the 72-hour rule. So if you message within the VA app, they have to reply within 72 hours. And we've seen a really good positive response with that as far as community care, primary care, nurse case. So good on that. But one of the biggest areas that a lot of veterans have complaints on is the re-submission and the re-eval for community care. So they already have their provider, they've been seeing them. Luckily, what you guys briefed this morning with the 1-year extension now, but there's been many times where that re-authorization takes 4 to 7 months, and then oftentimes those, they're missing out on, the provider has openings, but community care hasn't been improved. Are you guys measuring those metrics for the reauthorizations, and or is there anything being done to address that specifically?
For community care, that would be then under the health side, right? So again, I don't have much information for you there, and I don't know if Lonnie,
Normally, sorry. Hi, okay. So normally when it comes to community care, as far as our involvement, we usually reach out to patient advocates. Since that's owned by VHA, But a lot of times, it's really just a matter of trying to get a hold of them or, waiting for some kind of response. So we do have a lot of VHA on our MS Teams, and so it's usually quicker for us, I think, to reach out to them on your behalf. I don't know if that answers it, but again, community care is more of the VHA lane than ours.
And the last point I'd like to bring up is really on, I'm from the Olympia, Lacey area, and there's really good community care providers, with a lot of the services, except for really mental health in one area. We just don't have enough providers in the area for community care. And reaching out and talking with some of the providers in the area, one of the obstacles they have to come is the credential process. And we have one provider that worked at the VA for 15 years. He worked with SOCOM for 15 years, and then he has to get re-credentialed at a new place, and it still takes 7 months. So that's just one area that, I recommend and, ask you guys to look into as far as how you ease the access for providers to get credentialed for community care.
That's probably another good VHA question, and we often have a VHA breakout session. We don't have one this time around, but nevertheless, there are lots more questions, and I know there were some folks over on this side of the room that were waiting, so I will continue to work my way around. Was there someone back here?
My name's George Dodd, Veteran Service Officer in Chehalis. I've been doing this for a couple of years, working with veterans since 2014. As one of the things I want to mention about the DIC and stuff like that, and this is general working with the community, I'm also the Veterans Relief Fund Coordinator. And so when someone comes into my office requesting assistance for burial of a veteran, I also look at the death certificate. And just recently, kind of going back to what you were saying, the spouse wasn't receiving anything for disability. Presumed he was a Vietnam vet, saw hypertension, all that other stuff. She was able to claim DIC. Took some time, but we were able to get it and stuff like that. My question is on the PAC Act, again, that's a lot of this. One of the things, I had a veteran come in, we put in for a PAC Act claim, he met the time frame and everything else, burn pit situation, everything else. And on the letter, which was kind of weird, the denial, it said that it's presumed that he was in the area, but the doctor said it was more likely than not caused by him smoking. Even though it was presumed that he was there and he was in that situation, but now the doctor, so is the doctor's overriding the presumption, or how does that work out? Because I kind of caught that off guard when I saw that.
Yeah, it might be specific to a disability. I don't know if Lonnie, you have something to say that, there's, I believe, there's, again, it's the PACT Act kind of expands the avenues and makes it a little bit harder for us to say no. There might be something on that specific veteran that gives let's say that there's, we might have a medical opinion from a doctor that says that this disability is more likely than not a result of something else. And in that kind of case, for that specific disability, that medical evidence, it would override that, right? So, like,
That's what I'm saying.
yeah,
I guess I'm trying to understand,
Yeah.
even, you're already saying presumption,
yeah.
and we have proof before and after, and then, so it's
Yeah.
kind of weird how you can say you're presuming a disability, but then the doctor says, no, I don't presume it.
Yeah, there is a web of regulations and things that we do have to deal with in the VA. ALS I bring up just because it's a simple, clear-cut example. Another example is lung cancer and Agent Orange. Again, you might have smoked 2 packs a day for 30 years, but if you get lung cancer and you're exposed to Agent Orange, that is presumed. The PACT Act is again, it opens and expands the ways that we can grant service connection, but in many instances, specific instances, it's not as absolute as ALS or lung cancer with Agent Orange would be. Yes, sir.
My name is Larry Brass. I'm a volunteer. One of the areas of emphasis is finding those often career people that had retirement, TRICARE, that spend the last few years of their life homebound, bed, their wife, their sole caregiver. During all those years, they were satisfied, had a certain amount of pride, never looked at VA, pass away without any of the survivor benefits being there. They're out there, we slew them out, but they're out there, they're not being reached. But my question, Steve, was for you is, in your opening, you mentioned the convenience of the Jacksonville for your location. And I'm wondering, are you convinced that the Jackson building is your very best location, say compared to maybe Kent or Issaquah, Snohomish or Buckleteal?
I can answer that for you.
Okay.
We're gonna give him a break. Okay, maybe the better question would be, where do I need to be, right? So Steve hired me to be a public contact representative, and so my job is to go out to where you are, go out to where your veterans are. I realize that nobody likes to go up to Seattle, and some days neither do I. So we find that it's more beneficial to go to where you are. Now, I can't hit every veteran in the state. I wish I could. But I will go out to the vet centers in the state. I'll go out to some of the CBOCs or community-based outpatient clinics, stand-downs, right? Homeless shelters. We go where the veterans are, because I know they're not always going to come up to me. And some of the ones that we do, we go out to Silverdale, the clinic out there. They have been telling us for years, how come you closed the Bremerton building? That's a whole different subject. But their clinic it's on fire for us. We go there once a month. Sometimes we've got to go twice. And I get there at right around the time they open, and there's already a line for me. So, because they don't want to cross over the water to me in Seattle. And I don't want to either, so I'd rather just drive to you. It's great, I can take care of a lot of people that way. Outreach events like this, you'll see me on table number 2, I think, and I do a lot of one-on-one conversations. Because maybe you or someone you know has questions about benefits, survivor benefits, things like that. And so I think, me and my team, I think that's what we're here for. We're supposed to go out to wherever you may be. I'm not gonna lie, I get a little scared going to some of these places. But you know what, sometimes I figure if I just travel in a little group, I am set to go out to Mission Creek, I think. We're still getting our vetting done, so I will be visiting the women veterans out there that are incarcerated. We've gone to some homeless shelters. I will only go in the daytime. So we'll take care of them there. We'll work with social workers. Because really, Seattle's an awful big place. But have you ever had to pay for the parking out there? It's crazy. So easier for me to come to you, I think. Now, as Steve said, I also have a very small team, but my team is the whole point of my team is to be out of the office, working with you guys.
I'm really glad to hear that. But maybe because I'm a East Sider. Many of us here on the East Side see the Jackson building as a fortress. The parking around there is the moat. And inside you have to keep all the locked doors. Maybe we're wrong, but that's the way we see it.
And personally, I get lost in the elevators in that building, so, but thank you for talking about that. One thing that I do want to mention is veteran service officers. One thing that we hear no matter where we go in the state is that we need to get more veteran service officers out there helping veterans and their families, and we agree with that. Over the years, if I go back not too long ago, 2011, we had 0 county veteran service officers in Washington state. We had really 0 tribal veteran service officers or tribal veteran representatives helping veterans fill out that paperwork, but they just weren't accredited as service officers yet. We did not have that many state service officers. We've done a lot of work there. We have 23 counties now that have county service officers serving 28 counties. We have 11 federally recognized Indian tribes with memorandums of agreement that allow us to provide training and accreditation of tribal service officers. We still have the nonprofit veteran service organizations, the American Legion, the VFW, the Disabled American Veterans, etc. Some of them receiving some state funds through WDVA, and we've hired more state veteran service officers, meaning our own employees that are out there doing this work as well. All of those are great options, and we still can't be everywhere all the time. So that's a large part of the reason why we need your work as veteran service providers that are working alongside us to help steer veterans to those veteran service officers. The legislator has expressed their intent to expand the county veteran service officer program in the future. There was a bill passed this year modernizing, updating the county veteran service officer program, and with the intent to expand it in the years ahead. But budget appropriations were tight, so we didn't get any additional funding this year. So the legislators heard that too. They've heard that we need more VSOs out there. And I kind of joke with my bosses that when we have all 39 counties on board, I know I can retire, right? That's going to be my legacy that I go out on. I might not make it that long. It's taken a lot of years to get to 23 counties, but we're going to continue doing that work because we can't be everywhere. We need organizations, many of the organizations that you represent, to help us as well. There was a question here, and then I'm going back over the other side.
Shannon with Skamania County, so I've got a couple of questions. My first question is, do you guys ever come out to Skamania, Clickitat, Clark County area? Because we're kind of that fine line. All of our VA stuff is done in Oregon with Portland, but Seattle's our region.
Sure do.
That's funny you mentioned that, because we just got an invite to attend your stand down. So we will be there.
Awesome.
Yeah.
That's great. Okay, my next question. National Guardsmen. I understand that they're state militia and pretty much they're drafted to represent their state, to do stuff with the state. So before 9/11, they weren't deployed a lot. Well, we're running into a lot of veterans who were injured while they were doing their state missions and everything. What do we do for these people? Because they get denied and their ID says DOD on it, just like ours. I mean, we're taking care of DOH.
Okay. So we are dealing with veterans that are on Title 10, right? And then if it's not Title 10, I'm not saying we're gonna deny it. It's probably gonna take a little bit more work, but that's okay. I would still encourage them to file. Call me. We'll just do that, okay? I believe that there's someone here that's attending the conference, Annie DeAndrea. She's one of the guardsmen at Camp Murray by Joint Base Lewis McChord, Fort Lewis, and she's a great resource. I actually go to her for a lot of those questions because on our level, I don't see a lot of guardsmen, but I'm not saying they don't exist, where she sees them all.
Yeah, I was just going to mention that Annie DeAndrea, the Transition Assistance Advisor for the National Guard, will be here tomorrow at the VSO Community Collaboration Panel, and she is an expert on that topic about how to help those Guard members file a claim, and the rules for evidence and the evidence that's required is a little bit different. So we'll talk more about that because that's an important one.
Glad you got microphones. I think you're who I need to talk to. So perfect. So how do we coordinate to have you come out and be in location? I'm sure you're coming out to Grand County for the stand down meeting.
When is it?
So, Trevor, what day is it?
September 27th.
I'll have to look at my calendar.
But that's okay. What we've done is we've created a veterans hub, and we have space where we can have you come in, even just coordinate once a quarter, once a month, and be able to connect with veterans as we go through that. How do we make that coordination?
Call me. call me. So I would request that I need as much lead time as you can give me. We have approval processes in place, and typically it's like 30 days. However, if we still can't do it because it's just too soon, we can do something over Zoom. That we can do that. We can do like a very micro level teletown hall or something like that. You'll have my email by the end of today, and I think we're going to be good friends. So
Okay.
I would open it out to all of you. That's my whole job, is to reach out. I'm the only public-facing entity at the Seattle Regional Office. So everyone else is considered kind of like a closed campus because they are busy processing claims, right? But my job is to go out and meet everyone and get claims generated. So I believe, unless you hired me for something else, that's what I took it to mean. So, yeah, just call me.
Yeah, perfect, thank you.
Yeah.
Steve, you mentioned earlier that being service connected opens the door. That being service connected opens the door for so many other things. I've been picking up along the talk about what those things can be, but can you just lay out and specifically what doors being service connected opens?
I think the main thing is healthcare, and I used to know all the different, so like at 50% service connected, you get a certain level of healthcare and so forth and so on. The easy one too is if you're service connected for your knee, you get free healthcare for your knee at the VAMC, right? So, whereas if it wasn't service connected, you just go to your normal doctor and you pay whatever you have to pay, right? So, I mean, that's the main thing, right? But I'd say there's all these other different types of rules for all these other types of benefits that you may not need them now, but you may need them later on, you know.
Yeah, it really depends on the individual disability, like what their disability is, what their percentage is, because that opens the door. So it's very much based on the individual disability. The healthcare can't be overlooked. That's the biggest one. You get healthcare for that disability. But even if you're 10% service connected, there's other types of healthcare benefits that now are free of charge all of a sudden, like durable medical equipment, hearing aids, eyeglasses, even though they're not related to that disability. Veteran readiness employment, formerly known as VOC rehab, if that disability is a handicap from employment, veteran might also be eligible for VR&E benefits. That's an education benefit, right? They may not be eligible. It depends on how that disability impacts their ability to work, what their work history is, what their education training credentials are. But there's also some state benefits that I want to talk about. So if a veteran's a service connected, there's certain state benefits like state parks passes, transportation reductions in public transit agencies, there's reduced hunting and fishing licenses, there can be property tax waivers, that is income-based, but there can be property tax reductions. It's hard to say all of the things because there are so many of them. We really want to talk to that veteran about, okay, what are you service connected for? What percentages are you? What challenges, struggles, or barriers might you be experiencing in your life? And can we help back that into eligibility for a program that might help you overcome that barrier, whether it's healthcare, or housing, or financial assistance? So that's kind of the work of a good VSO, is to be thinking about those things in the back of our head, right? To help the veteran, kind of address their challenges, barriers, their in life. But we can't put it all like in a book in one page, because even those thick books that the National Veterans Legal Services Program publishes doesn't cover it all. I saw a few more questions that I want to get to. We'll come back up front.
Hi, Katie Jones, Colville Confederated Tribes. This is great that you're here on the benefit side regarding the PACT Act and other things. I'm wondering, I've talked to people that I can think of one off the top of my head. Vietnam vet, 5 tours in Vietnam. Not 1, not 2, or anything like that. 5 tours in Vietnam. I'm wondering, obviously this man was on the ground, in the air, everywhere, if he's special forces, which he was. Now, I know I've heard and I've seen the whole list of presumptives and everything like that. I'm wondering at what level do you decide that a person becomes eligible through Agent Orange for disability? Does this person have to be like on death's bed? Do they have to have cancer? Do they have, because this gentleman doesn't have cancer yet, but he has been denied numerous times on this. And it's nothing, I mean, I can't even imagine how it must feel to be a hardened combat veteran and have the VA, the government that you serve, that you believe in, that you fight for, more or less just kind of slap you in the face and say, you know what, it sucks that you've got this, that, or disability, but no, you know, it's not this, that, or the other. So, and so I'm just wondering, I'm new to the VSO field, so I want to be able to help these folks instead of watching them go back and forth like this man has. He's fought and scratched for years. He's finally at 90%. To me, this is an atrocity. This is a hardened combat veteran. He didn't stand on a boat. He didn't fly over in a plane. He was down there in the jungles of Vietnam for 5 tours. And he's had to spend most of his adult life, he's 79 now, most of his adult life to get to where he is now with multiple problems. So me as being a new VSO with this, I would really like to know, since you're on the examiner side and you've seen these things and your job is based around this stuff, what can we as VSOs do? What can we target when we put in these claims that are going to help avoid these kind of turndowns for our combat veterans? And I know another veteran, the same thing, Vietnam vet. I think he did 1 tour in Vietnam, possibly 2. He was a door gunner, got sprayed in the face with this stuff, the same kind of thing. And I believe he's in pretty much the same boat too, at 90%. I don't think he has cancer yet. But to me, cancer shouldn't be the only thing. I mean, these guys have high blood pressure, they have diabetes, they have your wisdom tips, and they're still not getting anywhere. So what can I do as a new VSO to avoid all this back and forth, where each time they put in a claim, they might get 10% more, or this, that, or the other here and there. To me, a hardened combat veteran, there shouldn't be a 10%, 20%, 30%, 60% PTSD. A hardened combat veteran, really. But that's just me speaking, that's my uneducated side of it. But I'd like to know as a new VSO, what I can do when I'm putting through these claims that are going to help these people the most in the shortest amount of time. Because let's face it, our Vietnam vets don't have long to live. And I'd like to get it right the first time. Thank you.
Yeah, thank you. Thank you for sharing. You know, I wonder if, you know, I see a lot of VSOs in here, you know, that's gotta be frustrating, and you gotta. One thing I'm keenly aware of is that I just get the paperwork, and I make the determination, and you know, I send back 70 or 0 or 90, but it's you all who have the veteran in front of you, and sometimes their spouse and their kids, grandkids, and they're in your office, and they you know, you see the effects of the decisions that we make, and you know, sometimes it can be great, and sometimes it can be really, really hard. You know, I deal with the regulations that we have, and kind of going back to we're dealing with each individual veteran and each individual veteran's service and their disability. It's, it's for everybody who raised their right hand and swore their life to the United States, right? It's not based on their character, the number of tours or anything like that. It's based on the evidence that we get, and I completely agree with you. That documentation. That veteran has gone above and beyond, and I feel like you're feeling like the VA is letting them down.
I absolutely do.
You're not letting them down. We are, and I don't know, VSOs. Do you have any advice?
So one thing that was mentioned was individual unemployability. A veteran can apply for individual unemployability. Age is not a barrier, right? So that's one option. With that said, we are at time and we do need to wrap it up because we got to turn over the room, get ready for the next presentation. Our guests from the VA, myself, we will stay and answer questions and chat with you even if we have to move into the hallway when they start the next session. I think that was a good place to end, Katie. Thank you for talking about that because that really speaks to the heart of the matter. How do we help veterans qualify for these benefits? And as VSOs, we learn so much from each other. We learn so much through continuing education, through those conferences, that training. We don't always know all the answers, but as you were asking the question, another VSO in the back of the room is already angling, well, unemployability, individual unemployability, right? Because we're thinking in the back of our head, how do we help that veteran get to that next step? And frankly, they deserve it. We know that. The challenge is how do we, as VSOs, develop a strategy to help them get there based on the eligibility that exists under the rules already, right? So anyway, that's a whole other topic. We get into the weeds on the nitty-gritty being a VSO. Guys, thank you very much. We will stay for questions. The next session starts at 2:45. 2:45.
I'm still here.